Okay, so today we have Miss Stacey here, and she is gorgeous as you can tell, but we all love the sun sometimes. So when we are out in the sun, we tend to get a little bit of the fine lines and wrinkles, and the sun kiss is what we call sun damage, right? So this is an off-label protocol that I like to use for patients that are trying to get that youthful glow to the skin back, but also to target the under eye bags that we tend to get. Sometimes you can get Botox for preventative, but if you wait a little bit longer and you're in your 30s, 40s, and you do have already the lines there, this is a great protocol for this specific problem, okay? So this is the anti-aging booster from Perfect Derm. And the main thing is to make sure that the patient does not have allergies to salicylic acid or aspirin, because it is salicylic based. So the face has been cleansed and alcoholed. We're gonna spot treat with the spot treatment, and it's gonna be a little uncomfortable for the patient, but it just in itself neutralizes. Go ahead and look up for me, babe. You do want to make sure that the patient is not wearing contacts, but if they are, just make sure that you're not moving the eyelids too much. We do a couple passes. As you can see, she's getting a little red in the area. Scale 1 to 10.
2.
Okay. This is a tough cookie. We want to see a little bit of the frosting, because this is really what's gonna get this lifted and tight. So now that I've done 3 passes under each eye, I don't have any signs of frosting or blanching. Now I'm gonna mix, I still have some of the spot treatment left. I'm gonna use the actual rest of the Perfect Peel. You mix them together, and now we're ready to go ahead and treat the whole face. I'm going to apply some layers. This is also great for fine lines and wrinkles around the mouth area. So now, one contraindication that you do want to be careful with as a provider is if the patient tends to get cold sores or fever blisters. That would be one thing that you do want to know about the patient. Now that we've done one full pass on the whole face, we do want to wait a couple minutes to see if the body or the skin is having any sort of reaction to the peel, if we have any frosting or blanching. Remember, salicylic acid does self-neutralize. While we wait, this is one of my favorite treatments in the sense of combination treatments. When you do a chemical peel and pair it up with any neuromodulator, such as Botox, Dysport, or Xeomin, at the time that the patient is going through the process of peeling, the neuromodulator is having time to activate. So by the time the patient's done peeling after the 7 days, their Botox or any neuromodulator has kicked in at this point, so they have this amazing fresh look. So it's my favorite. It's like a little mini liquid facelift. How are you doing, Stacey?
Great.
Now that I've noticed that her skin is tolerating the procedure well, I'm going to be a little bit more aggressive, and now I can go at a faster pace with my peel. So we're going to layer it up again. This is second layer. At this point, you're not going to go underneath the eyes anymore. You always want to fan down the neck. A lot of people forget about that, and then you have that unevenness. The neck is not as thick as the face, so make sure that you just do 1 to 2 passes. But remember, ladies and gents, that is one thing that shows our age, so you want to make sure that you treat the neck as well. Give me a deep breath, 1, 2, 3. Yeah, the top one's always a little bit more uncomfortable. Raise your eyebrows. Relax.